When one of your family members becomes a doctor, you think of the risks, the mental health risks, being overworked, and oftentimes you don't think about like, hey, you could get HIV or hepatitis or any of these other diseases that are transmitted through bodily fluids. Chris is about to call me and let me know if his HIV test came back positive or negative. My heart's racing. I'm like super nervous. Hey.
Hi.
April 13th, 2020, I was asked to fit in a procedure on a patient from the immunodeficiency clinic, the HIV clinic. You know, you have a patient who has a history of HIV, you think, okay, I gotta be really careful here. Just keep in the back of your mind not to stick yourself. It's almost like you psych yourself out and then you end up doing things slightly differently, or just, anyway, I don't know. It just happened very, very quickly. Scrubbed my finger under water, soap and water, and ran it under there for 10 or so minutes. Went to the emergency room and got checked in. This is just one more thing to worry about amidst all the things going on with coronavirus. Here I'm thinking I gotta dodge one infection and I end up potentially getting exposed to another. So I should probably call Becky and let her know. She's gonna be very worried, so let's give her a call. Oh, 1 sec now. Chris Nicholas speaking.
Hi, John Klaus from ID. My ID said that you stuck yourself.
Yeah, I did.
On Truvada and anti-centrist, I hope.
I just got that prescription. I started my first dose. All right, well, thanks for the input. Really appreciate it. Bye. Chris Nicholas speaking.
Hi, Christopher. This is from CVS Pharmacy. It looks like we're getting a couple scripts for you. Just wondering if you have prescription coverage.
I have Blue Cross Blue Shield. I got an RX group. Do you want that string of letters?
Yeah, okay, that's it. Okay, yeah, the insurance went through just fine.
All right, thanks so much.
Okay,
Bye now.
bye-bye.
Okay, a lot of phone calls. Anyway, I'm gonna go home and I probably shouldn't call Becky. I should probably tell her in person. Just given kind of the sensitivity of the topic. Anyway.
Okay, so let's pause for a second. There were 1 million things running through my mind at this moment. First of all, as a physician whose practice does not really focus on HIV, I hadn't even thought about it since medical school. Like, I knew the basic facts, like HIV stands for human immunodeficiency virus and that there is no cure. I also knew that it can be spread by transmission of bodily fluids, such as with sexual intercourse, pregnancy, needles, etc. And I also knew that viruses infect the specific cells in the patient's immune system called CD4 cells, and they essentially hijack those cells and force them to start producing copies of the virus. Patients don't actually die of the HIV infection itself. It's actually the opportunistic infections which are a problem, and they're more prone to those as HIV compromises the immune system. And that's where the term AIDS comes into play. When a patient's CD4 count is less than 200, or they contract a specific type of infection that generally only affects people with compromised immune systems, that's considered AIDS. But none of these facts that I learned in medical school helped answer any of the questions that were actually popping into my head at that moment. What if I contract HIV? What are the odds of me contracting HIV? Is this considered a death sentence? How will people treat me? How will my wife treat me? What does modern HIV treatment look like nowadays? Despite being a doctor who knew all about HIV, I didn't know shit about HIV.
It's amazing. The hospital's like a ghost town. Aside from people coming in for COVID-19, I think everybody else is staying home. So you're gonna have ICUs on bust. Emergency room's probably pretty busy, but everywhere else, complete ghost town. Dr. Klaus.
Hello.
How are you, sir? I'd shake your hand, but I feel like that's taboo now, especially with an infectious diseases doctor like yourself.
I know, I try to.
Why don't you sit in this chair here? We'll maintain our 6 feet.
Got it.
All right, so I'm here with Dr. John Klaus. Is it Klaus or Klaus? How do you say your name?
It's Claus, but I don't correct anyone that says Klaus.
People always call you an infectious disease doctor, and then within that you sort of specialize.
You can fall in love with a virus or, a bacteria, and that's your thing. You see very interesting things in patients with lower immune systems, and the risk, which is reported on paper as 1 in 300 per needle stick episodes, is probably much less than that.
My anxiety should be less than it is right now. Is
Absolutely.
basically what you're telling me.
Absolutely.
Okay. So in the patient that I was stuck with, this person allowed us to divulge this information.
Yes.
To be fully HIPAA compliant. They had an undetectable viral load as of February, I believe.
It was the middle of February when's the last time I checked.
Viral load refers to measuring the number of physical copies of the HIV virus per milliliter in a patient's blood sample. Having an undetectable result means that no copies of the virus were detected in the sample, which can often be achieved through modern HIV medications. Now, undetectable does not mean the patient is cured, and it's technically different than being HIV negative.
It's called U equals U, so it's undetectable equals untransmissible. You cannot pass it to your sexual partner. We strive for our patients to be basically 0, which is undetected, but it's only as good as the test that you have. 15 years ago, undetectable might be less than 500 copies in your blood per milliliter. And now our assay that we do in-house here goes to less than 20, and then it can be less than 20 detected, and then it can be undetectable. There might be 1 or 2 copies floating around in there, but according to that test, they cannot find any virus in your blood. And it is concerning to people that are patients where their viral load will blip, so to speak. And so this patient had a blip in his viral load, and when we checked it 2 weeks later after your incident, and so it was 31 copies, I believe.
So it had gone up then?
Which I know is very unsettling. I've seen patients with much higher viral loads and percutaneous injuries, and they do not convert. And like I said, the statistics are in your favor.
I knew about the undetectable viral load from February,
Right.
and I think I was going this whole time thinking, it's undetectable, it'll be undetectable again, and then it's like, no, it's not undetectable. The rational side of me is saying, well, I mean, it's low, but the emotional side of me is thinking, well, fuck.
I don't mess around with this kind of thing, and so I offer to everybody. There are people that are saying, "Oh, it's the operation is undetectable. It's a low," and I was like, "No, like don't be a hero. Like this is something that you should take." And most people are usually pretty receptive to it.
When am I in the clear? Like, when can I say I 100% have not contracted HIV?
We give you the medication within 4 hours, ideally 1 or 2. I don't know what your story was, but I was told it was kind of very quick, kind of same day thing.
I literally went from the ultrasound department to the emergency department and had medication in my system within an hour.
And that's the best you can do. After 28 days, you have a repeat HIV test 4 to 6 weeks after the initial injury, and then you have one 3 to 4 months later. And if the 3 to 4 months one afterwards is negative, I would say you're in the clear. That window period for being exposed to becoming positive is about 2 weeks. But I would say, long story short, the one that they do after 6 weeks from exposure that's negative, you should be absolutely fine. But they have this sort of 1 in a million case where someone converted between this and this. 4 months, it's a long time for you to wonder and kind of feel, very anxious. So.
Yeah, for sure, yeah.
I know you're probably going crazy being on quarantine, but like living in your house by yourself, like I'm gonna get like a stray dog soon and just like bring it up because I can't.
What's going on with you?
So I had a little accident at work today.
What?
I had a needle stick injury from a patient from the HIV clinic.
Do you have it? You don't know.
You don't know. Yeah. It's I went to the emerge to do the proper stuff and got blood work taken and all that stuff.
Are you okay?
Yeah, I'm okay. Are you okay?
Not really.
Well, you don't have to be sad or scared. I mean, probably a higher chance of dying if I got COVID than this situation here now.
I don't really know what to say.
I don't think there's anything really to say.
Do you know what's so fucked up? That teeny tiny little insignificant mark on your finger could change your entire life.
It's kind of fucked up to think about.
Can I put the camera down and react like a normal person?
Mm-hmm.
Are you done?
Yeah.
Wait, did you wash your hands?
Anyway, I'm gonna go get a shower now so I can go clean myself off.
I'm supposed to have a meeting in 20 minutes, but how am I supposed to have a meeting after getting used like that?
So the ER gave me a week's supply of medication, which included Truvada, an antiretroviral for preventing HIV, 1 pill a day, Icentris, also an antiretroviral, 2 pills a day, and Zofran, an anti-nausea medication in case I had any side effects. So the ER told me to go to the pharmacy before the week's over and pick up the remainder of my pills since I only had a week's supply. But this is where things got interesting.
Update, I'm on the phone with my insurance company, calling looking for a reason for the discrepancy there, why the Icentris was $1,100. And they said, well, you haven't met your deductible yet. I said, okay, well, why are the other 2 medications $0 copay and basically covered? And it turns out that the other 2 medications are considered quote unquote preventative, And the Icentris, the third medication, was not considered preventative. And I'm literally taking these drugs to prevent contracting HIV. If that is not the definition of preventative, I don't know what is. Literally on the CDC website, since 2013, they've been recommending these medications as the standard of care for post-exposure prophylaxis. I guarantee you there are patients who cannot afford this, who are coming in and foregoing the standard of care and ultimately putting themselves at higher risk for contracting HIV. I'm on hold now, waiting to talk to somebody. Can you tell this is one of my triggers that I'm worked up? I just can't fucking stand when companies like this are inserting themselves between a physician and the patient. Absolutely fucking unacceptable.
I can take a verbal grievance over the phone with you. The premise on filing this grievance is because it is preventative to prevent you from contracting HIV, so you feel that this should be reviewed to be processed as a preventative medication.
Yeah, I agree with that. How long do you guys usually take for this process?
Again, it's going to depend. We're looking at 15 calendar days.
So this is a very time-sensitive issue. Is there any way we can expedite that?
That's what I'm checking right now.
Thank you for holding.
Unfortunately, there is nothing at this time I'm able to do. If you are able to afford to purchase with the grievance.
All right, can you tell I'm worked up? I'm a little bit worked up. If the outcome of this grievance is not a policy change on the broader scale for everybody, then I am not going to rest until this is seen and fixed. I feel like Twitter's a really good place for that. I'll give them the chance to do the right thing before I launch into an online roast. Yet again, another eye-opening experience in the U.S. healthcare system. Okay, I'm gonna go home. Becky's waiting for me. I've already wasted an hour and a half of my time here.
So you are from Newfoundland, huh?
We are, yeah. You know where that is?
I've never been there, but I've seen Come From Away 19 times. So I
Oh,
feel
wow. Okay.
like an affinity. I would like to go, but I have not yet. So there's an ongoing belief among some people that HIV medications are really hard to take. One time that was really true. The pill burden, which refers to the number of pills a person had to take, or the size of the pills, was both of them were big. During your post-exposure, you probably did you take 2 or 3 a day?
I take Truvada once daily and the Icentris twice daily. So three
Okay, so that's
pills a
only
day.
3, and that's a full regimen. But I mean, a lot of people are on 1 pill once daily regimens for HIV treatment now. The pre-exposure prophylaxis is once daily. Most people experience no side effects whatsoever. You made reference earlier to having been written for Zofran, which is to control nausea. Early in my career, again, not a clinician, but would work with people who were on this. The medications people were taking at the time for post-exposure even made them very, very nauseous. And medications now are less likely to do that, but people still are given the nausea medication, which fortunately you didn't even have to take. Is less toxic than it had been in the past and is more effective than it was before.
So 10 years ago, you were having a lot more cases of AIDS than you are today with the current drug regimes in place.
Yeah, I don't have numbers in front of me, but yeah, for sure.
So Matthew is a wealth of knowledge. He works for an outfit called Evergreen Health, which is a nonprofit healthcare provider in Western New York. And they kind of specialize in chronic illnesses, sexual health, LGBTQ specialty care, stuff like that. Something else that we discussed during our conversation, though, was the difference between pre-exposure prophylaxis and post-exposure prophylaxis, PrEP versus PEP. Pre-exposure prophylaxis means taking a medication, basically Truvada, if you haven't yet been exposed to HIV, but you might be at a high risk of exposure. Say, for example, if you're in a relationship with somebody who is HIV positive. Post-exposure prophylaxis is taken after a potential exposure to HIV as a means to prevent contracting the virus. For example, in my situation, after getting stuck by a needle that was possibly contaminated with HIV. So while these scenarios may sound very similar, they're actually quite different. And understanding the differences was the linchpin in at least partially understanding how I ended up in this messed up situation with my insurance company.
To your grievance from yesterday?
Oh yeah, thanks for calling me back.
Yeah, unfortunately, it's not on the New York State PrEP $0 coverage mandate, and that's what we would use to determine if it's preventive or not for the zero copay.
Why are you guys using a protocol for PrEP when it's this PEP that we're talking about?
I'm not a pharmacist, I'm the grievance person, but they informed me that it applies to that.
Okay, I'm still kind of confused though. PrEP is irrelevant to my situation.
Post-exposure would not be preventive, so it would be subject to your copays, your deductibles.
Why are you covering any of the drugs that you're covering for this situation then if there's no coverage for post-exposure is my question A. And B, it's preventing me from contracting HIV after being exposed to it.
But we must follow mandates.
So who Who makes the
These are
mandates?
New York State mandates.
So, can I point you towards a CDC approved article that says that this drug is 100% the standard of care since 2013 to prevent contraction of HIV in a post-exposure setting?
Post-exposure is not considered preventive.
Dude, literally the definition of prophylaxis is preventative. You are the one who's making a decision on what should be covered and what should be not. Don't try to point fingers at mandates
We have to follow the mandates.
So what you're telling me is you're cherry-picking data on what you consider as preventative based on what is financially viable for your company, is what you're telling me.
No.
Because
It's
this
on the U.S. Preventive Services Task Force website.
additional
Prevention.
approaches to prevention. Prophylactic intervention with antiretroviral medications, both pre-exposure and post-exposure, can prevent HIV infection.
It's not covered as preventive.
But you just told me that this you just told me you go by the mandates based on this site. The site literally says pre and post exposure. I don't know what to tell you, man. You pointed me towards the website, and I'm looking at the website that literally says pre and post exposure for is a preventative measure.
If we go by that guideline, I'm looking at it.
The guideline that you sent me, which literally says both pre and post exposures are approaches to prevention.
They can prevent, but doesn't say it's part of the preventive coverage.
This type of semantics and going back and forth, all you are doing is you're wedging yourself between a patient and their physician and providing a financial barrier that, in the end of the day, it results in people not getting the standard of care, and that is absolutely unforgivable.
I understand what you're saying, but you gotta understand we're also the health insurance company. We cannot.
Correct.
We have to follow the rules and mandates.
You keep talking about mandates as a mandated statewide thing. Mandates are a bare minimum. You're following them because you have to. But then you're also saying you can't cover anything else in excess of the mandates because you're not allowed.
No, we can.
You just choose not to.
We are a business.
Exactly.
Yes, we are a business.
And you wouldn't make as much money.
That was the most rage-inducing conversation that I have ever had. But during the conversation, I did realize where all the confusion was coming from. Private health insurers in the US by law must cover pre-exposure prophylaxis at zero cost to the patient. So essentially they have to cover the medication Truvada. But coincidentally, Truvada is also one of the 2 medications prescribed for post-exposure prophylaxis. And my understanding is that much of the behind-the-scenes billing stuff between insurance companies and the pharmacy regarding price is all automated, to the point where any Truvada prescription will just get dispensed at no cost under the assumption that it's for pre-exposure prophylaxis, which is how I think I got the Truvada at no cost, but they still wanted $1,100 for the Acentris. And it took hours to figure this all out, and I still don't even think my insurance company actually understood what was going on because they were still paying for the Truvada in full. It was mind-blowing. Anyway, before this experience, I didn't know a lot about PrEP or PEP. In fact, PrEP wasn't even really a thing when I was learning about HIV in medical school, and the only reason I actually knew about it was because of my friend Nick.
Hello.
Hey buddy, just realizing how much I need a haircut now.
You have so much hair, it's crazy.
This is probably the first time I've looked at myself in somewhat of a mirror in a while. Thanks for agreeing to being part of this video, I should say. The early studies regarding PrEP were done when I was finished med school. Evidence was just coming out, so it wasn't even a thing when I was going through medical school. So that tells you just I guess there's this big disparity on even physicians like myself, how little we know about HIV if you don't have it as part of your practice.
I belong to a family practice out in the suburbs as my primary care provider. Even when I started bringing up PrEP to them, she was just like, I'll have to look into it. I was like,
yeah.
Okay, sounds good. Let me know how I can help.
I want to just kind of see what your perspective is as somebody who lives and thinks about HIV probably a lot more than most people do.
Yeah. You might not suffer from the stigma, but you still might suffer from the mystery of this whole thing. A lot of my experience as a queer individual was a lot more secretive before then. So it wasn't really I could ask around about HIV and the way that you contracted it and all that stuff without kind of giving myself away,
Right, you're trying not to out yourself, let alone try to find information on HIV. That's not even on your radar at this point.
Exactly, totally. I was really thankful that I had some gay men who I became friends with. That first summer I came out, they kind of ushered me through the gay community. You know, we would go out to bars, like they you know, even helped me with like setting up a grinder and things. And like, I don't know if I would have ever started to think about it if it wasn't for them. Like, it definitely helped me to be like mindful of like, okay, like these actions can have invisible consequences.
Yeah.
It wasn't until in that year, 2015, when I started seeing someone and they were like, hey, like, have you ever been tested for HIV? I'm like, no. Like, what kind of question is that? And he's like, not that he was gobsmacked by that, but he had family who worked at Evergreen, so like it was very much part of his like normal everyday life. And so I went with him for my like first ever HIV test, and like, man, I was not nervous about if I had it or not. Like, I didn't think I did. That seems dumb to me to think back, like, I don't think I could have it. Like, of course I could have had it.
So talking to Nick, it really shined a light on the disparity in knowledge of HIV between straight communities and LGBTQ+ communities. Like, as a straight dude, this is just stuff I never had to think about.
The earliest cases of HIV were found in gay and bisexual men, and also, not as frequently said, but is true, transgender women. The next wave of discussion was around intravenous drug users, and so like those became the populations that people most associated with those things. We don't see a lot of HIV transmission through intravenous drug use anymore, not none, but we don't see a lot of it, and that is due to solely to the availability of free and clean syringes for people to use. So that's not to say that there is no transmission through needle use, but there's a lot less. There has been a humongous wave of social change around the way that gay, bisexual men and transgender women are viewed by the rest of society. And there's also been a big change in the way that many of us look at drug use and drug user health. But if we place ourselves more than 30 years ago into that social structure, which I do think we've improved on but not perfected since that time, you're looking at a disease that was impacting people that the larger part of the population probably looked down on anyway. The overwhelming majority of pre-exposure prophylaxis users are gay and bisexual men, and so there are plenty of other people who could benefit from it. But it is good to talk to someone about it because there are probably solutions around whatever you are thinking about. We have heard this or something just like it before, and we are ready to talk about it. The biggest thing that we try to like blow people's minds with is the notion that the person who's telling you I am HIV positive and on treatment is probably the lowest risk person that you're going to encounter. We have to sometimes flip around what we think we know and find out that it could be the opposite.
Definitely like brought a lot of fear to people. You know, the like stigma of it, and just like everything revolved in like what we're thinking about right now in 2020 is like similar to like feelings that they had in like the 80s. There was many factors to why like, the queer community was being like isolated, because it's so technically private. Like, you know, like you and I could have sex, and like Becky could never know. Like if we didn't tell her, it's like it's not like I know. Sorry, Becky. Not only was it hush, like being like sex, and then being gay, and then like HIV, like it was all just like a smaller and smaller pool, but like nonetheless like more and more hushed. It wasn't really until people started talking about like, no, like we need to talk about this, making it such a easy thing to talk about. Like it should be easy, you know.
Right.
Like I had someone that I was like going on dates with for a while who like was HIV positive, and the first night we met in person was at a bar. Was like one of the first few things he told me. He was just like, hey, like that we're like hitting it off. I just want you to know, like, if you know I should go home with you tonight or whatever, like I'm positive. It is not this scarlet letter. Having those experiences kind of gave me like a perspective, being like I am not ever going to like negate or judge someone who has this.
Update, I now have a letter specifying that I have a workers' compensation claim, and allegedly all I have to do is give this letter to the pharmacy, and they will then use this information to bill the appropriate services. So I'm hoping it's a little bit more pain-free than my last experience.
So when this all started, I was 100% focused on getting to the emergency room and getting medication in my body ASAP. I didn't waste any time going to HR first to file an incident report, as again, my priority was getting medication in my body ASAP. Which I did, and as a courtesy, the ER called the prescription into my pharmacy, so naturally that's where I went next. Of course, this opened up the whole can of worms about who was gonna pay for the treatment, but in the end of the day, I was eligible for a workers' compensation claim, which I did eventually file. But regardless, it still absolutely sickens me to think that if an exposure happened to, say, an individual in the community, and they needed post-exposure prophylaxis the same as I did, they might be stuck in this pharmacy purgatory between their insurance company and the pharmacy. And if they don't have $1,100 hanging around to pay for their medication, then tough shit. They don't get medication and they forgo the standard of care. And that just doesn't seem right to me.
Hey there, I had a prescription to pick up. Last name is Nicholas, first name Christopher. Yeah, I got a letter here for a workers' comp claim and all that.
You're gonna have to come in and fill out some paperwork.
I do, yeah.
I guess they need more information from your employer.
What more information do they need? Let me call my HR person here. I'm at the pharmacy here now, and they're saying there's not enough information on this form. Is there anything else you guys needed other than just a phone number?
I think that should be...
Just that? Okay, I think that's all we need. I'll call you back if there's any other issues. So should I go home or should I stay here?
I would say you're probably good to go home, and we'll give you a call as soon as we hear back.
I've got to come back because I have to reach out to the insurance adjuster. Well, I should mention that I'm due for this medication at around supper time, so. Okay, it's now 6 p.m. and 2 hours till the pharmacy closes. I hadn't heard from them, so I called them and they said, oh, we haven't heard back from the insurance adjuster. They needed to run it by them because it was a high cost item. Initially, they said, just take one of the medications that you have already, and then as soon as we get this to you, we'll get it to you. It's like, no, that's not acceptable. I was prescribed this medication for a reason. I need to take this on time. Finally, they said, okay, yeah, we'll give you 4 pills to tide you over until we hear back from workers. So I'm driving to the pharmacy to pick up my 4 pills. It shouldn't be this difficult to do the right thing, you know what I mean? Things should just work, I think, better, and maybe that's just a vague, entitled complaint, but you know, it's just funny because I have time to do all this now where I'm off on vacation, but if this was a normal work week, I wouldn't have time to chase these things down. I would assume that, oh, well, I filed the right paperwork, I have the right paperwork in my hand. I was told, oh, just give them this letter and you'll get their medication.
Hi.
Hey there, last name Nicholas. Perfect, thanks so much. I got a few of my medications. That sounds like more than 4. Yeah, that's definitely the full month's supply. Anyway, I'm not going to complain. I guess I don't have to go back now, so.
Christopher?
Yeah, hi. It looks like there was the full bottle was there.
Yeah, it was an error. One had the 4 for you set aside, and I grabbed the wrong one to give to you. So it's kind of, bad that I did that. Yes, we do have to have that full bottle, because it wasn't intended for you to have the full bottle.
Well, I mean, does it really make a difference at this point? It's not like it's a product that you can return and then dispense to somebody else. They've already been dispensed and I've already contaminated them,
Right.
we'll say.
Just 1 second. Christopher,
Yeah.
Well, the bottle, it hasn't been approved for sale. I mean,
you can't sell them. They've been dispensed. I'm confident this problem will fix itself tomorrow when they call back and say that, okay, that's fine. It seems like the logical solution to this problem would just be have me hang on to the pills that I've already taken and accepted that you can't do anything with anyway, and then figure it out with the finances on the back end. Yeah, and they're gonna approve it. And if they don't, I'm more than happy to work with you guys. Like, I'm not gonna, you got my address. I ain't gonna skip town. Okay, thanks very much.
Well,
Bye now.
Well, thanks for talking to me.
Yep, no worries. Take care. Bye. So I finally got my medication, and let me tell you, between going back and forth between the insurance company and the pharmacy, this was exhausting every step of the way. I mean, even as a physician, I found this whole process riddled with barrier after barrier. And maybe it's just the cynical side of me, but I can't help but think that the whole system is like this by design. Like these companies knowing the more roadblocks they put up, the less chance they'll have to pay out.
I mean, you're a person with direct professional knowledge, with a medical training, employed, insured, and still came against a cost that was shocking to you. And so I would say that there is a vulnerability, certainly when a person walks into a pharmacy, and is told about these costs that they did not know that they had. The clock was ticking. And so all of this time is wasted time. Your body's doing whatever it is or isn't doing while you're talking to people about whether who's going to pay for it.
Yep.
If it's too tight, let me know. I'll loosen it for you.
Do you believe, though, that I have a fear of needles?
Chris is about to call me and let me know if his HIV test came back positive or negative. My heart's racing. I'm like super nervous. Hey.
Hi.
Say hello.
How you doing?
I'm like shaking and I feel like I'm gonna vomit.
The test was negative.
Oh, thank God.
There you go. So, file that one away.
Yeah.
Months later.
Fuck.
All right.
Well, I'm relieved for you and I'm relieved for me, and that makes this 2020 and just this tiny much easier. The relief of knowing that you're not going to be on medication for the rest of your life at this point.
Yeah.
God. Well, thanks for letting me know.
All right. Love you.
I love you too. Have a good day.
Bye.
Be careful. That's a huge relief.
So this whole process has taught me a lot. HIV, not a death sentence. Second, regardless of risk factors, preventative drugs are available that are both highly tolerable and highly effective, and making the chance of contracting HIV almost negligible. And finally, knowledge is power, so get tested.
More and more people knowing that HIV is a treatable condition, and also knowing that treatment means no transmission forward, like those things have also propelled people a bit more toward action.
I like to tell all of my patients that you will die with this disease, not of it. The problem in the United States is that of the million people that probably have it, 1 in 7 don't know that they have it. If we could give everybody that's banging on our doors for a coronavirus test an HIV test, I'd be all for that too.
So a big thank you to everyone who participated in these interviews, particularly to Erie County Medical Center, who also treated me as one of their patients. And just a reminder that both ECMC, Evergreen Health, and likely any similar resources near you are continuing to provide essential services during the pandemic. So please, please, please do not delay essential care due to fear of COVID. If you find yourself potentially affected by HIV, there is treatment available. Stay safe out there.